The Global Fund provides grants for HIV/AIDS, tuberculosis, malaria, and health system strengthening to low and middle-income countries like Sierra Leone. As the Global Fund Grant Cycle 6 ends on 30th June 2024, Head of the Grants Management Division at Global Fund, Mark Eldon Eddington, and his team from Geneva officially presented a dummy check for the Global Fund Grant Cycle 7. At the launch of the fund, President Bio emphasized that since 2018, his government has prioritized human capital development, focusing on education, health, and agriculture. He stressed that improving access to health care is crucial for the productivity of citizens, enabling them to pursue viable economic activities.
It is with great pleasure that I launch a total approved amount of $136,244,674 United States dollars for the purpose of Sierra Leone to fight against HIV, tuberculosis, and malaria, and to strengthen the health system. I'm also pleased to announce 6.7 million United States dollars in counterpart from the government as part of our commitment to improve human capital development within the big 5 game changers. When we talk, we do. This substantial commitment increases our contribution by 43% from the previous cycle, for which government met its full obligation.
Mark Eldon Eddington highlighted the Global Fund's commitment to supporting Sierra Leone's development and health agenda. Since 2005, the grant has provided over $500 million to combat HIV, TB, and malaria, fostering a healthier, safer, and more equitable future for all.
Today we're launching new grants worth $136 million for the period June 24 until June 27. And we see these as an investment in your national health programs. We don't see them as a project. The grants we're launching today will be implemented by the Ministry of Health and World Vision International in their roles as principal recipients. Both principal recipients, as well as civil society organizations and communities, have an important role to play to ensure those who need services the most are reached. We also ask for your full support, Excellency, in ensuring accountability and transparency in the use of Global Fund resources. We owe it to our donors, many of whom are here, but even more so, we owe it to the people of Sierra Leone that we serve. When operating in high-risk environments where episodes of corruption are high, it contributes to delays in implementation, as each procurement process needs to be highly scrutinized by Global Fund assurance providers.
The U.S. contributes over 31% of Global Fund resources, making it the largest donor, with $24.87 billion since 2002. U.S. Ambassador to Sierra Leone, Brian David Hunt, committed to supporting Sierra Leone through the U.S. emergency plans for AIDS relief to surpass the Triple 95 goals, diagnosing 95% of HIV positives, providing antiretroviral therapy to 95% of those diagnosed, and achieving viral suppression for 95% of those treated by 2030.
In furtherance of this work, the United States will invest more than $8 million this year to support HIV/AIDS care, treatment, surveillance, and laboratories in complement to what the Global Fund is bringing to the table through this new grant. Through the President's Malaria Initiative, the United States will also continue to support wide-ranging efforts to reach zero malaria by investing an additional $16 million this year.
The Ministry of Health will receive $110 million and World Vision will get $26 million. The Minister of Health, Dr. Austin Demby, admitted that Global Fund's substantial investment in Sierra Leone has resulted in unprecedented progress in the fight against HIV, tuberculosis, and malaria.
The number of people living with HIV receiving medication has increased from 38,000 in 2018 to 69,331 by December of 2023. We have reduced the number of missing TB patients from 5,000 3 years ago to less than 3,000 in 2023. Our malaria burden has dropped from 40% in 2016 to 22% in 2021. These achievements speak to our collective commitment and the tireless efforts of our healthcare workers, partners, and communities. In addition to fighting these diseases, our partnership with the Global Fund has strengthened our community's health service and health information systems. Together, we have seen the provision of solar energy to health facilities, installed oxygen plants, prepared for and responded to public health emergencies.
World Vision, one of the principal recipients of the grant, also pledged $750,000 as a contribution to equipping the planned national warehouse. The grant will help the ministry to achieve its 98 goals for HIV, tuberculosis detection, and malaria control in Sierra Leone. Salifu Charna Kamara, AWAV News.